Nobody told me my surgery almost killed me because of my gut, but now I know, and I'm telling you. Every year, millions of people go into surgery with a compromised gut, and nobody warns them. Not their surgeon, not their anesthesiologist, not their primary care doctor. Here's what the research actually shows. Your gut microbiome directly impacts how your immune system responds to surgical trauma. A compromised gut means a compromised immune response, period. When your gut lining is damaged or inflamed going into surgery, your body has less capacity to fight infection, heal tissue, and manage the inflammatory response that surgery triggers. This isn't a theory. Studies show patients with poor gut microbiome diversity have significantly higher rates of post-surgical infection, slower wound healing, and longer hospital stays. And if you have diverticulitis, your gut is already inflamed, already stressed, already running on fumes. Going into surgery that way is like driving a car with a cracked engine block and hoping for the best. I know because it happened to me. Diverticulitis led to a colon resection. The colon resection led to a ventral hernia. The hernia repair led to MRSA. One thing caused the next, and my gut was not prepared for any of it. What nobody told me before either surgery: gut bacteria produce short-chain fatty acids that protect your gut lining. A damaged gut lining allows bacteria to migrate into your bloodstream, and post-surgical infections are far more likely when your gut barrier is already weak. There's also your migrating motor complex, your gut's built-in cleaning system, and it gets disrupted by anesthesia and pain medications. If it wasn't functioning well before surgery, recovery gets significantly harder. So what actually moves the needle before surgery? Repairing the gut lining with L-Glutamine and zinc carnosine, rebuilding microbiome diversity with targeted probiotics, reducing systemic inflammation through food and specific supplements. And after surgery, gut healing isn't optional. It's the difference between recovering and struggling for months, wondering why you still don't feel right. Most surgeons are focused on the surgery, and that's their job. They're good at it. But nobody's focused on the gut ecosystem that determines whether your body can actually heal afterward. That gap is where people fall through. I built an entire protocol around this because I lived it, I survived it, and then I spent 5 years figuring out what I wish someone had told me before I went under. The protocol that got me through MRSA recovery became the foundation for everything I now teach. Targeted gut lining repair, strategic microbiome rebuilding, anti-inflammatory food protocol, supporting the MMC so the gut moves the way it's supposed to. None of it came from a prescription pad. Start with the protocol that changed my recovery. The link is in my bio, or you can go to livingproofprotocols.com.